Streaming?
Select the session. Excellent.
Oh. That's the first time it said that, isn't it? So it might work? Oh my god.
It's the weather.
Are you trying to sign in? No, I just really want to see this particular channel and see if there's a live video or not. Still upcoming. But it says we're on, so
Maybe it's lagging.
it might be.
Excellent connection.
Well, and it says we're live. So we might as well act like it, I guess. No matter what, we'll get a recording out of it. How about that?
Yep.
Facebook's just as bad. Just as bad. Okay, now it says we're actually live.
Oh, nice. Hello, hello.
Here we go. See if I've got this pointed the right way. Maybe? Yes?
Yep.
Is that okay?
Yep. I'm gonna fall off my
Don't do that.
step. There we go. Up.
That'll work. Okay. We're here. I really need, I think we need a different job instead of setting up streams. I think we should just show up and have it already done for us. Someone else should do it, because
we need a better IT person, and it's
evidently
not me.
it's not me
It's not
either. I'm bad at it every time. It's some kind of problem. But welcome back. We are here to talk about laser therapy today. This is the Healing at the Speed of Light podcast. I'm your host, Dr. Jason Roundtree. I'm a certified medical laser safety officer and chiropractor. And this is Christy, who is a certified laser therapy tech. And we're here to talk primarily towards patients. But if you're not a patient, or you're maybe a prospective patient, or you're a healthcare provider, you are certainly welcome to chat with us today, because we are always talking about research. And today's research is a brand new study from August of 2025, and I've been really trying to keep up with a lot of these studies, but it's like impossible. There are hundreds.
They're coming out too fast.
Yeah, they absolutely are.
Which is a good thing.
It is really good. But you get so many studies, and you start going, okay, which ones do we even want to talk about? Which ones are the biggest impact? And this particular one caught my eye today because it is not just a clinical trial where they bring patients in and laser some of them and don't laser some of them and see who gets better faster. This is actually a consensus on laser therapy from the researchers who have been doing this stuff for decades now.
Okay.
And
Decades.
So, decades.
That's a critical component.
Yeah.
Because this isn't new.
It's not new, even though it's red light therapy and things has become a real buzzword over the past few years. We've been seeing people use lasers for healing and light therapy for healing for much, much longer. Like you said, yeah, decades. So we'll jump right into what this study says, and then we'll talk about kind of what it means. But we want to answer the question that every single patient is going to ask, and that is, does laser therapy work? And is it going to work for me in this condition that I have? What does it work for? What doesn't it work for? And then some other things that are important to talk about too, like what are the risks? And what does the evidence say? So that's exactly what this particular paper goes over. So if you want to look up this consensus that was published, it was published in the Journal of the American Academy of Dermatology back in August of this year, 2025. And the title is Evidence-Based Consensus on the Clinical Application of Photobiomodulation. And photobiomodulation just means light healing, essentially. You're altering the biology of the body by using light. So that covers things like red light therapy, laser therapy, really anything to do with light and trying to non-invasively heal the body. So not laser surgery, not cosmetic laser, anything like that. We're talking about using light in a positive way to affect the biology. And that can go towards lots of different conditions, which is something we're going to talk about here today. So what they did these researchers all started getting together and started going, okay, who's really got the most experience looking at light therapy and laser therapy in the research studies? So not necessarily clinicians, although some of these researchers are also clinicians, but primarily looking at the folks who have been doing these studies. And what they wanted to know is, does laser therapy work? Is it safe? And what does it work well for at this point? What do we know? And then what do we not know still, too? Because with thousands and thousands of studies, there's going to be a lot of things that we do know, and then there's still going to be some holes in our knowledge here. So they started getting together this multidisciplinary panel of experts. They ended up with 21 researchers who have been doing this for a long, long time, and the panel included medical and cosmetic dermatologists, neurologists, physical medicine and rehabilitation physicians, dentists, and pulmonologists. So a very nice mixture.
That's a huge mixture.
Yeah. Of not only academics but also folks who do treat patients and then who have been conducting research. Now,
Well, in all areas that it can be beneficial.
right. Yes,
Oh,
exactly.
sorry.
No, it's exactly right.
Spoiler
And
alert.
yeah, and yes, we've seen it. But a lot of the clinicians were dermatologists, and I think that's interesting because many of the conditions that we will use laser for have some kind of dermatology aspect, from wound healing to hair loss, to things like radiation dermatitis. All those fit into the dermatology side well, and people a lot of times think about laser therapy for things like knee arthritis or tennis elbow, and that's absolutely true too, but we shouldn't forget about the very common skin conditions that light can have a good effect on.
Right.
So they brought all these folks together, right? They started talking about, what does research really show? What do we know? What do we not know? And they said, okay, well, look, we're going to just define photobiomodulation in general as the term. So we say laser therapy a lot because that's the primary tool that we use in clinics are lasers, but photobiomodulation is really the blanket term to cover it all. These effects were initially discovered following irradiation or application of the laser with a low-power ruby laser, which resulted in hair growth. That was a mouse study way back in the 60s. And so that was where this whole thing began. And they said since then, there's been a lot of different kinds of light sources that can work, like LEDs and lasers. And it really depends, the effects that you have really depend on the wavelength, the energy density, the light structure, and the duration of the laser, like how long you apply it, how many times you apply it, and for what time period you're going to do it as well. They came up with a whole list of conditions and started going through, what does this work well for? And they basically came away with saying, if I can get the right page, here it is, that we have level 4 evidence for musculoskeletal conditions in general. Level 4 evidence meaning that we have evidence from expert committee reports and opinions and clinical experience of respected authorities, and all that is, of course, based on the clinical trials that have been done, the actual real world seeing patients get better. So level 4 clinical evidence for musculoskeletal conditions. Now, musculoskeletal condition would be things like what?
Well, your joints and, muscles, that sort of thing.
100%, absolutely. So sprains, strains, even fractures, wounds can be a factor there too. So very, very good evidence for that. That's what this team of experts decided, is that we really know that laser works quite well for musculoskeletal conditions. Now, there's lower grades of evidence for a few other things too, but still very good levels. And those items are wound healing for burns and diabetic foot ulcers, as well as scars and skin rejuvenation.
So, this is a silly question, but you've got level 4. How many levels are there?
In their system they're using, I believe level 4 evidence is the highest.
Okay.
And that's a very good question. There's a couple other systems out there that will throw around some different levels, but as far as what I can tell, what they're using, level 4 is the highest, because their level 3 evidence is a lower grade, and it includes evidence from non-experimental descriptive studies like comparative studies and correlation case control studies, and those are just not quite as robust as actual clinical trials with the kind of consensus of all these respected authorities, essentially. So radiation dermatitis, scar regeneration, hair regrowth, moderate to severe burn recovery, wound healing in general, and then also they talked about peripheral neuropathy being a pretty commonly accepted condition that you can treat safely with laser. And that's the next thing that they came up with, is that they said, look, this is really very safe. They said there is no DNA damage associated with red and near infrared light, so it's completely safe. We have had patients before ask, hey, is this going to make me have cancer or something like that? And the answer pretty consistently has always been no, and that's what these folks are saying here too. What these researchers are saying is that there's just no evidence for any level of DNA damage. They do say there can be some mild side effects. They're generally very temporary and self-resolving, which means they don't last long and they go away on their own. But generally it's things like a little bit of extra pain or discomfort, some burning, some blistering in some cases, which would be for very poorly done laser potentially, because I've never seen anybody burn. But sometimes a little bit of redness and swelling.
Yeah, or tiredness.
Tiredness is the one that I see, yes. You can really tell that you've had something done with some of the treatments. It'll just make you more tired. It's all very short term though. It's 24 hours or less where you just feel a little run down, but it's because you had a significant procedure done, basically.
And maybe a little achy, but that
Yeah,
goes away
a little
as well,
achy.
It's
It's very much like a post-workout soreness.
Right.
Like you went to the gym, you worked out real hard, and then you're kind of sore that next day. That's kind of what a good laser treatment can feel like sometimes, depending on what you're working on, especially. Right. So, the total verdict here for does laser work is a pretty resounding yes from all the researchers that have been working on this stuff for decades. It is also extremely safe, and while there are still some questions on exactly what all the mechanisms are of how it works, there's really no question that it absolutely does work for musculoskeletal pain conditions, and it's a great tool for so many of the other things too, like hair loss, burn wounds, diabetic foot ulcers, and peripheral neuropathy as well. So, if you haven't looked at laser as a solution for something you're dealing with, definitely consider it. You can find lasers in more and more clinics now. I mean, it's a massive improvement from when we got started teaching back in 2019. We've got thousands and thousands of more clinics that are running laser. Do look for someone who knows what they're doing.
critical piece.
It is, yes. Unfortunately, it's not like a light switch. You can't just turn the laser on and things get better magically. You have to know a little bit what you're doing. If you're a provider and you want to know more about what you're doing and know how to use laser for some of these conditions, get a hold of us. It's exactly what we're here to do. If you're a patient and you're looking for laser therapy to help you with something, you can still get a hold of us too, and we'll try and connect you with someone who knows what they're doing. But in the meantime, we're moving ahead with the research, and it's looking just better every year.
Every month even.
Every month even.
So.